Welcome to the CareCliques 5-minute demonstration. This product will show you how you can move from fee-for-service to value-based care models as a practitioner with relative ease. The trend towards value-based care is moving along progressively, and starting in 2015, pretty much ending around 2020, 90 to 100% of reimbursement will be based on value metrics, hence the name value-based care. So instead of paying for claims, they're paying for quality metrics and other standards of care. In order to assist the practitioner to shift to value-based care, the CareCliques solution is an EHR add-on module that is really specifically designed for these issues. It's designed to segment, stratify, and prioritize care needs for various patient groups. The Care Plan Builder is used to drive automated engagement programs, and patient and caregiver apps are designed for web, mobile, and Apple TV. As we'll show in this demo, the product is a productivity app for care managers and care coordinators and is designed to reduce physician burden and improve clinical quality scores. It supports many of the upcoming and current value-based care programs, including chronic care management, prediabetes program, MIPS, MACRA, and other associated programs such as bundled care and readmission reduction programs. As a cloud-based application, simply log into the system, select your account, and you'll see your dashboard and hot list of activities. Select from the buttons on the left to navigate. You can also select from other pull-downs, such as the patient recently viewed list, or communication options such as secure mail, which includes text as well as voicemail recorded and transcribed, in addition to real-time chat, which is also secure, runs on mobile and web, for patients as well as other care providers. Telephones are also integrated into software using a soft phone technology, so you can make calls to any phone line as well as receive them. You can also track the time and also notes for those calls within the system. Selecting your hot list gives you tasks and items for each patient that's upcoming. The dashboard area shows you various dashboards for prediabetes, chronic care management, various disease panels and quality outcome measures, as well as MIPS program under MACRA. The patient list reveals various cohorts or groups of patients that you can set up custom or use the built-in collections which relate to bundled care, wellness, readmission, as well as chronic care management. The patient list generally lists patients by specific factors relate to the program, as well as a risk score that's adjusted in several different parameters, as well as a number of care gaps that exist or quality gaps for that particular patient. Drilling into a patient is simple. Just click on the patient. The view you see next is the same view the patient or their caregiver would see if they were to log into their account. It shows you the goals and the progress against those goals in visual format, as well as a list of tasks which are upcoming and are each labeled very clearly. When clicked on, result in more information about that task. So it could be a survey they need to take, a visit they need to go to, a video they need to watch. All this information is tracked. We also allow you to use other technologies such as real-time secure video chat to engage with patients directly on an ad hoc basis, or track vitals using various wearable devices. The patient goals and various tasks on the timeline are set up using a centralized care plan tool. You can access that tool by clicking the Care Plan button. You'll notice you get a narrative view, which you can simply hit the Edit button to create new narrative, use our built-in assessments to actually drop in new narrative or macros, and create a comprehensive, well-balanced care plan. You can then share this with other users using Direct Connect, which is a secure email to other EHR systems. The Care Path section allows you to use a pre-formatted set of tasks organized by problem or disease. You can modify these specifically for each patient, or even add new templates or new tasks. Adjusting a task is simple. Select from the menu and select the parameters for that particular item. You can pull from various wearable devices that you can set up with 1 or 2 clicks. We support over 200 devices built into the product, or pull from the library of videos or other contextual information for patient education. Once care paths are set up, you can track the engagement and compliance with these tasks, get alerts, and also track day-to-day activity using this screen. Interactions with the care managers and the patient are tracked in the case notes section. These notes may be generated automatically by the system when you complete a call, message, or modify a care plan. The medical section allows information such as current med lists to be displayed in easy-to-read fashion, as well as select and add monitoring devices, patient summaries, and survey data. The care team can be adjusted using this screen, and invites can be sent out securely through this screen as well. To the administrative view, you can also adjust the product using the Config button. This allows you to add new providers, adjust enterprise settings, create new webinars to invite patients to, adjust resources to be shared, patient panels, and quality metrics to be selected for MIPS macro. The shift to value-based care really requires the practice to start thinking about care coordination and care management in a new way and integrating that directly into their practice. The software we've shown today allows even a small practice to compete with larger practices with respect to value-based care, care coordination, and other quality metrics.